Hi, and welcome to my presentation of No Pain, No Gain. This presentation is meant to help those that experience chronic pain, those that have a loved one or a friend that experiences chronic pain, and it's even beneficial for those who don't experience chronic pain. And I'll explain that why as we go. Before we move on, I need to give my little disclaimer. My name is Dr. Phil Hickson. I'm a physical therapist. I have my master's and doctorate in physical therapy, and I'm certified in therapeutic pain neuroscience, which has just given me uh, accreditation to be able to explain pain to those who experience pain, to practitioners, to be able to explain pain to their patients, whether it's medical doctors, nurses, other physical therapists, or what have you. Um, the Obviously the disclaimer is there. I've been told to have a disclaimer that this isn't medical advice, but I'll often tell my patients that pain neuroscience is going to affect your life, whether you believe in it or not, just like gravity. I could take something and just drop it on the ground. You can't see gravity, but it definitely affects your life, whether you believe in it or not. And pain neuroscience works in a similar way. And I ask you that you give me an opportunity to explain why that is. I never want to assume anything about my patients. I don't know why you're watching this presentation. Maybe you're experiencing pain or you have a loved one that experiences pain. We never want to assume anything because why? You make an ass out of you and me. But I am going to go out on a limb and assume a couple of things about you, why you might be watching this presentation. It's most likely because you want your pain to improve. You want to move better, feel better, sleep better. Basically, you want your life the way it was before your injury or the pain experienced is that it became an issue, and you're not quite sure how to do that. And part of the reason can be you've been through the medical system. You've been prescribed medication. Maybe you've had surgery. Maybe you haven't. Things like physical therapy, chiropractic care can be prescribed, acupuncture, injections, massage, other types of medical treatments. And if that works for you, that is fantastic. I love to hear that. But what happens when it doesn't work? That's where we start to run into a problem. And that's where over 80 million people in the United States and 2 billion people worldwide suffer from chronic pain every single day, at least some form of it. And they often have not um, benefited as much as they would like from things like medication and surgery and physical therapy. And with chronic pain, even though these things can be beneficial, you're probably not going to get to where you want to go. I say you might have minimal benefit from these things if you don't have a proper foundation in place. So it's important. And what I do with my patients is we need to start building a foundation from day one. And I want to share that with you. And part of this foundation, or I should say, this foundation has many pieces, and no piece is more important than the other, but instead they are important all together. There's no one thing that's going to help you start moving forward with your life. So let's talk about this foundation. And one of the first things is you need better knowledge, a better working knowledge about how pain works in your body. Where does pain come from? Is pain normal? Are you going to be in pain the rest of your life? If you're going to get better, how long is it going to take? And I'm not claiming that I have all the answers, but we know so much more about how pain works in the body over the past 10 years than we've known over the past 1,000. And I want to share that with you. And I hope that you share this with other people because it's important that everybody, children, adults, doesn't matter if you're 2 or 102, you have to know how pain works in your body because that will actually help turn the volume down on pain, believe it or not. But that's not enough. Learning about pain is not enough. It has to be learning about pain and other things. And some of those other things, just having an appropriate exercise regimen. What challenges you and you specifically? As human beings, we love to compare ourselves to other people and ask other people what worked for you, what was helpful for you, because that may help me. And that might be true. But comparing yourself to other people is like apples and oranges. Comparing yourself to yourself is a much more accurate way of telling if you're getting better or not. So how are you right now and how are you 3 months from now? That is in fact the way to tell if you're getting better or not. or 3 months from now, months from now, a year from now. But having an appropriate exercise regimen, including things like strength and flexibility and range of motion, balance and endurance, all these things are important. But if that's all that's focused on, you're only going to get so much better. In order to make maximal improvement, it has to be an appropriate exercise regimen and other things. So having a better working knowledge about how pain works in your body, having an appropriate exercise regimen, sleep is so important. I can't say it's more important than anything else, but it is right at the top. In chronic pain or not, if you're not getting quality sleep, it's going to affect your health. It's going to affect the number of years you get to spend on this planet. And poor quality sleep also plays a huge role in the amount of pain that you experience from day to day. So it's important that sleep is also focused on getting better quality sleep. And there's a lot of ways to do it. Maybe some ways you've tried, but other ways you haven't. What I'll often tell my patients is when you're a teenager and in your 20s, sleep comes easy for most of us. You don't even have to work at it, it just comes. As you get into your mid 30s and on, sleep becomes more of a skill. You have to practice it to get good at it or to stay good at it. And if you don't, you're going to get poorer quality sleep. So sleep is so important and plays a significant role in why people experience pain for a number of years. Setting goals. Setting goals is really important, but not just I want my pain to go away. Yes, that is a goal, but we need to go further than that. We need to be more specific than that. So starting to set what are called SMART goals. And this has nothing to do with intelligence, but SMART goals are goals that are specific, measurable, attainable, realistic, and there's some sort of timestamp, some sort of deadline to let you know that you either achieved your goal or you didn't achieve your goal. And we'll go into more detail later on in this presentation. Uh, Improving your social life. Pain, it is a physical experience. It's also an emotional experience. It's a psychological experience and it's a social experience. And I talk about the biopsychosocial model when it comes to pain because that is essentially treating people as a whole person. And you might be watching this because you have chronic back pain or neck pain or shoulder pain or knee pain. And our medical system, as wonderful as it is, loves to have its blinders on just the painful body part that you have and nothing else. But we fail to realize, or the medical system fails to realize, that there's an entire person attached to this back, or this neck, or this shoulder, or this knee. If you're having headaches, it's really important that we treat you as a whole person because just focusing on tissues when it comes to improving chronic pain is not enough. If we only focus on tissues, we're missing so many pieces of the puzzle that people are likely going to improve some and then just plateau, which is commonly what people run into with chronic pain. Your nutrition. We'll talk some about nutrition. I'm not proclaiming that I am a nutrition expert, but there are certain foods and types of foods that can drive inflammatory processes, which can actually drive chronic pain. So it's important that you at least have some basic knowledge about how all of these systems and all of these things come together to either produce pain or reduce pain.